That is uterus. Please.
So again, we perform the manual separation and detachment of placenta when our patient will not have the symptoms of placental separation. So do you remember the symptoms of placental separation?
No.
So there are too much of them, but it will be better if you remember. Sorry, if you remember just 3 of them.
Atonicity prolonged.
Bleeding.
Labor. Is it atonicity down?
No, just symptoms of placental separation.
Bleeding.
So how we can identify that in this case placenta separated?
Bleeding.
Bleeding. Is that enough?
Yeah.
Excuse.
What else?
The all closed or
So for example,
Movement of the umbilical cord.
movement of the umbilical cord, how many centimeters? So when the fetus was delivered, yeah, we put 2 forceps on the, we put 2 clamps on the umbilical cord cut. So and the one clamp will come with the newborn, and the other one will stay on the mother's part. Yeah. So when we will see that this clamp will go down nearly 10-12 centimeters, it means the placenta is separated. So what happens? Placenta separates from the uterus wall and goes to the lower segment of the uterus. Yeah. For example, I can push on the suprapubic region, and if I will see that umbilical cord goes inside a little bit, it means the placenta didn't separate. It's fixed to the uterus wall. If it will not go down, inside, placenta separated. Or I can see the changing of the shape of the uterus, yeah? So it becomes more flat. By the level, it will be higher than umbilicus, and it will rotate a little bit on the right side. It means the placenta separated too, yeah? So if placenta separated, I can tell to my patient to push a little bit, yeah? So she is pushing, and the strongest contraction should be in the in the third stage of labor, yeah? For the spontaneously separation of it. So, if for example, my patient has the symptoms of placental separation, she's trying to push, but she can't deliver the placenta. What are we going to do? Not manual, it's important. Yeah, no.
Massage.
uterotonics.
So we can go inside in the uterus in this case.
Massage.
External massage of the uterus. What else?
Oxytocin is given
We
external.
should give the oxytocin when the presenting part start to crowning for the prophylaxis of the hypertonic bleeding.
Misoprostol.
So the uterus will be on contraction in this case, yes? But placenta separated, it still will be inside in the uterus, but our patient can't push. For example, happen the edema of the cervix. Yeah, it's possible. Why not? So it will be the adherent placenta diagnosis. Yeah. So in this case, I should cauterize the bladder, so the bladder should be empty. I should lead uterus to the central position and perform the external massage. Then I can use one of 3 methods. The first one called by Abuladze. When I will take, you have to think that it will be the anterior abdominal wall. So I can take the muscles of the anterior abdominal wall, like this one, and my patient should push in this time. By Genter method, so I will put my hands on the fundus, so on the region of the angulus, yeah? So, and I will press. I will work with the uterus, so in this case my patient shouldn't push, yeah? And the last one, by Lazarevich credit method, so when I will put one finger on the anterior uterus wall and the other 4 to the posterior uterus wall. So I'm trying to lead it, and I'm push on it a little bit down and anteriously. And in this case, my patient shouldn't push too. So in this case, I will work if my patient will have the symptoms of placental separation, but she can't deliver this placenta, yeah, with the umbilical cord. And the last main view, so if there will be the placenta accreta, yeah, so if there will be no symptoms of placental separation in 30 minutes, so in this case, I can perform the manual separation and detachment of placenta. In this case, my patient should be in the anesthesia. So we are called to the anesthesiologist, and our patient will be, so he will choose the type more commonly we use intravenously. So my patient is sleeping. What I'm going to do? I should be dressed correctly, yeah? My hands should be clean, I should dress along gloves. How long it will be better. So, and then by my checklist, firstly, I should put the napkin on the anterior abdominal wall, and then I should clean the external genitalia like I showed it previously, yeah? And then I should put my hand, it's called the obstetrician hand. Like this one, it's the obstetrician hand. So, I take the umbilical cord, I should open the labias and lead by the umbilical cord inside. So when I'm coming by my hand in vagina, I should put by my external hand the fundus of the uterus. It's very important. If you will not fix the fundus, you will not perform this manipulation at all. It's impossible. So you open, it's simple, not like this. Not like this, yeah? So you should come inside by the umbilical cord. Open, fix the fundus, yeah? And there should lie the sterile napkin. Then, when I came by the umbilical cord, I found the soft tissue of the placenta, and I'm trying to find some angles from what I can start to separate. And my hand should work like a paw. Like this one. Yeah, so I'm separating the placenta. And then I should lead it down to the lower segment, and my internal hand should stay inside. It's important. So my hand stayed inside, and I will help to by my external hand to take away the placenta, like this one. So we took the placenta, and I should fix again the fundus and come by my hand by the all walls to take away maybe some clots or the membranes, or maybe after the examination I found that the placenta will be not full. Of course, in the after the exam or during the exam, you should say that placenta in full. In real life, it will not such beautiful like after the like during the after the labor. Yeah, there will be some. Just some parts of it, but on exam you should say the placenta is full, so there will be all the membranes. So when you came came by the all walls, you should take away your hand. So that's all. Your manipulation is over.
So doctor, we make an incision on the abdomen and then we put our hand from there to press this.
Yeah, so you can.
And the placenta, she used the other hand to push the placenta
Top of the stomach.
to feed that.
So I think the fundus.
Like she
Doctor.
pushed it from this.
When our hands are inside, we take this to support from the top to remove.
No. So I'm just fixing the fundus.
Okay.
That's all.
And
Just
then
holding it in place.
So when I will shoot, so it's like a control manual examination. Sorry. For example, we have the normal we have the normal third stage of labor, yeah. So placenta is separated spontaneously itself. But for example, our patient had the scar on the uterus after previous C-section, yeah, and we need to identify the condition of this scar. So I will perform the control manual examination of the uterus. So I will clean the labia, I will put the napkin, I will open and come by the all walls and try to find this scar, and I should identify is it full or not, because it will be not full. We should come in the operation room and put the stitches on the uterus.
so doctor, after we go in and find the placenta and we pull it down,
Yeah, you need to
One
choose
hand will be here,
yeah.
you pull it down.
Yeah, you need to choose the lower segment. You need to choose the lower segment, and your internal hand should stay inside.
Okay.
By your other hand, you will take away their placenta.
Together with both.
No,
No,
this
just
hand
one.
remains in. You
Just
take
by
only
external
placenta
hand.
மட்டும் வெளியே
Ah, okay. Take it like that.
எடுத்து.
And then I again and
Yeah.
then check the.
Yeah,
Any
And then
remnant?
finally, after everything is, I take both.
yeah. That's all there is.
Mm.